welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today, we welcome back on the show Farhan Imran. He is a hematology-oncology physician, and he wrote the Kevin MD article, "A Nurse is to a Patient what a Mother is to a Child." Farhan, welcome back to the show.
Thank you, Kevin. Thanks. Good to be back as a guest at your podcast.
We'll get into your article in a little bit, but for those who didn't listen to our first few episodes, can you just briefly share your story and journey to where you are today?
Sure. I'm originally from the northern part of Pakistan, and I went to medical school called Khyber Medical College. After that, I moved to the United States, and I've been in Rochester, New York. I did my training in hematology and oncology at Georgetown University. And then I've been practicing here in Rochester, New York at the Lipson Cancer Center for several years. So that's really my journey to where I am today.
So you had some of your medical training in Pakistan and some here in the United States. Tell me a little about that transition and what are some of the big challenges that you faced in coming over to the States?
So, of course, that is a very loaded question, could be a topic for a full podcast, but I would say that it is one of the best experiences for any professional. My dad was himself a physician and he did part of his training in Pakistan and part in the United States, but then went back to Pakistan and had a very fulfilling career. I always wanted to become a very thorough professional, and we always knew that if you go to United States, the training is the best, which it really is. I feel that we are trained very well, and it really feels nice to be working in such a cutting edge environment where all the new research and all the new studies are coming from. But it is never to minimize the work that people are doing in countries like Pakistan or other resource limited countries. Because I personally feel care providers, physicians, nurses are doing much more of a job than we are over here because we have a lot of resources at our hand. Over there, you have to use your clinical expertise. You may have patients who may not have too much income or resources. And to help those masses within the limited resources is really what they are doing better than us. So it's a pleasure to practice here or to practice. You just need to love your profession and enjoy it wherever you're practicing it.
So for those other physicians who started their medical training abroad and then come into the United States for fellowship or residency, what kind of advice do you have for them based on your own experience?
So my advice to those physicians is to work hard and to follow your passion. And there is great potential for a lot of fields in the United States, but there is so in medicine as well. One should not make it into eventually repetitive, boring kind of a job, but really try to find your interest and your niche. And it could be anything. It could be related to a certain field of medicine. It could be medical humanities. It could be social work, and not really to limit oneself to medicine only. The more people can work on their personalities outside of medicine, that will end up making them into better physicians as well.
All right, let's transition now into the Kevin MD article that you wrote. It's titled, "A Nurse is to a Patient what a Mother is to a Child." Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah, so there are a lot of thoughts in my mind about the nursing profession. And then this particular article I wrote, it was around the time of Nurses Week, which was being celebrated across the world. And it was my way of my tribute or my thoughts for the profession of nursing as coming from a physician. When we were in medical school, you do get interaction with nurses at all stages of your career, but really you really start having that exposure when you finish your medical school and then when you actually start your residency. And that's where you, for the first time, see the actual work that a nurse does versus the work that a doctor does. And for the outside world, people who look at the profession of medicine from the outside, in their mind, always in terms, if you were to call it so-called the hierarchy, the doctor comes first because they probably make the bigger decisions, or for whatever reason, people will always talk about the doctor. So if you ask any patient, they will know who their doctor is. They'll say, my doctor is so and so. But you will never hear a patient, anybody ask them, who is your nurse? Or my nurse is so and so. And by the way, the doctor also sees me. So I felt that the kind of work that the nurses are doing, that is so much more hands-on. And it is so much important that although nurses are given the recognition, but still doctors are given more recognition than the nurses. And in my mind, that is a little bit, the nurses should be given more recognition than doctors. So in my article, I broached this subject and I compared, I drew with what happens inside a house versus what happens inside a hospital. And that's where I titled it that if hospitals were households, nurses would be mothers and doctors would be fathers. Now, where that comes from is a little bit of my background at home, where I'm one of five brothers, and my mom was a stay-at-home mom, and my dad was a doctor, and he would go out of the house and, so to say, earn money, put bread on the table, but rest everything was done by my mom. And right now, with the way societies have changed in the West and across the world, the gender roles are blending, where a mom is also working and doing stuff at home. And the same thing, a dad is also going outside of the house and participating in household activities. But still, if you even look at America for a few decades ago, as I speak with my colleagues here, there was this nuclear family where the mom stays at home and the dad goes out. And there was a lot of pride in that. And there was a lot of recognition of that. But somehow I feel that the recognition of a stay at home mom has been lost or it is losing. So, for example, if there is a working mom, which by the way is double the work of a stay at home mom, as a working mom, you get degrees or diplomas or a paycheck, and you're given all those, recognition by the society. But a stay-at-home, her work is still invisible. If you look at a child, and if the child is very well dressed and well rested and has eaten well, and the house is in great order, nobody would really say anything about it. But if you see something not done, that's when you would point it out that this is not done. So I drew a parallel that in the hospital, although the doctor is coming in and the doctor is making the bigger decisions, but is spending what, like 10 or 15 minutes with the patient, but a nurse who is by the bedside and who is doing uh, all the hands-on care. She's the one delivering medications. She's the one taking care of the emotional aspect of the patient. Nurses are doing more and more procedures, they're making more and more decisions, but still, most of the recognition is given to the doctors as opposed to the nurses. So I try to draw some people who have not lived in that kind of a household where they would see uh, what a stay-at-home mom's power is. They may not understand this parallel, but in my mind, I truly feel that a nurse, in my mind, is doing much more work for a patient than a doctor is. So this was an overall concept in this article.
In your world of hematology oncology, can you share a story, example, or a case study of your interactions with nurses and how they affect how you care for patients?
So sometimes the inpatient setting is different than the outpatient setting. And one great story comes to my mind. I had a patient, I still have a patient who had small cell cancer of the lungs. And I started her on treatments, and she luckily did very well, and her disease was under very good control. She was a patient who drank alcohol heavily and more of a loner, where she did not really want other people to come to her house and she would just stay at home. And then that was her life, and she was happy and comfortable in that life, but still, she had not built long term relationships with anyone in her life. And that's why when she was upset or when she was sad or crying or when she had any symptoms, she didn't have anyone for her. Now, what I would do is that I would meet her at a follow-up appointment and I would just tell her, hey, your scans are looking good, blood work is looking good, immunotherapy is going okay, and let's just keep going. And I would talk to her a little bit about how things were at home, but that was the limit to which I went. But then the nurses detected that in the cancer center. And the next thing I learned, without anybody asking, the nurses actually started going to her house and really helping her with organizing her home and just to spend time with her. And they were sometimes taking turns, and they were not doing it because they were supposed to, they were not getting paid for it, they were doing it totally out of the goodness of their heart. And you could see the smile of that patient whenever she came back to the cancer center, which is a scary thing for many people, but for this woman, and this is just one story, many other women uh, uh, or men, they come to the cancer center literally feeling that they're coming home or to a friend's house or to someone's house like that. So this is one example where nurses have that, so to say, a maternal instinct. And I, even though as much as I tried to, I had a role to play, and they would still give me the credit. Oh, Dr. Imran has given you treatment and she's doing so good. But I was telling them that no, I just did what I learned in my residency, but you guys are the ones who are taking care of the actual patient. I just took care of the disease. So
We're talking to Farhan Imran. He's a hematology-oncology physician, and he wrote the Kevin MD article, A Nurse is to a Patient what a Mother is to a Child. Farhan, through your perspective as a hematology-oncology physician, what do you see are some of the specific challenges facing nurses today?
so nurses are being asked to do more and more, which they are doing as well. They're very competent, they're very capable. And other than that, probably if I talk to some of the nurses, they may be overburdened with being assigned a lot of patients, which sometimes the hospitals can help it, but other times they may not be able to help it. But I've seen nurses having such great resilience when our ERs are full, our hospitals are building these makeshift places for patients who are coming in, and with the COVID pandemic and everything, the way the nurses handled everything, I thought that this was amazing, and I can't say enough good things about nurses. And then one other quick thing that I would also want to say here, Kevin, is that if you look at the number of males versus females that would go into becoming doctors, if you look at the statistics from a few decades ago, it was majority males and just a few female doctors. And now, literally, if you look at a lot of statistics, it's 50%. Half of the physicians are male and half of the physicians are female. But if you look at the profession of nursing, still, I would say less than 10% of nurses are male. Why is that? Why aren't males going into the nursing profession? You don't hear about it. You don't see it promoted, you don't see it recognized. So that is one other thing that I really wanted to bring through your podcast, is for some of my younger colleagues who are planning on becoming doctors or trying to be in the healthcare profession, they should not really focus on just becoming a physician or a surgeon. They should also try to look into becoming a nurse. And I think that just like women over the decades have increased their numbers in becoming physicians, now men over the next few decades should participate in the nursing profession. And in 20 years from now, it should be a 50-50% chance that when I'm getting admitted to the hospital with a heart attack or a stroke, I may get a male or a female nurse, and it should not be a surprise. That is another point I wanted to bring.
And my final question, what's your take-home message that you want to leave with the Kevin MD audience?
For this one, really the take-home message is not looking for some sort of an improvement or a correction or a solution. This is simply my expression of the magnificence of the profession of nursing. I just feel like we always say the first rule that you learn when you become a doctor is that keep your nurses happy and your nurses will keep you happy. And initially, you're doing that just to maybe network or something. But as you spend years and years in this profession, you realize how important the profession of nursing is and how great of a work they do. Nurses in the US and in the West are still respected a lot. But unfortunately, where I grew up, nurses did not have much respect, and the society does not look at the nurses the way they should. So I just want to make people aware that next time, whenever you're thinking of thanking your doctor, please stop and thank your nurse first and then go turn to your doctor. That's what my take home message is.
Farhan, thank you so much again for coming back on the show and sharing your time and insight.
Thank you, Kevin.